Thanks again for joining us for today's St. Louis Metropolitan Pandemic Task Force briefing with Dr. Alex Garza. The briefing will begin in a moment. After Dr. Garza's opening remarks, he will address questions that have been submitted by members of the media. Reporters who have questions during the briefing can submit those to the Task Force Public Information contacts. We will address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody, and thanks again for making time to join us for this daily briefing. As I mentioned, I know this has been an extremely stressful time for people throughout the region, but on behalf of our healthcare workers here, we greatly appreciate all that people are doing to prevent the spread of the virus. Let me begin by acknowledging a few updates from earlier today that many of you may have heard. Both St. Louis County Executive Sam Page and the St. Louis City Mayor Lyda Krewson have extended their stay-at-home orders for the region, and they have done so indefinitely, with an indication that we will continue to monitor the data closely and revisit the orders in mid-May. Now, I know that these were not easy decisions for either the county executive or the mayor to make, and I know it isn't easy for the people of the metropolitan area or for our businesses. And as a doctor, as a resident, and as a dad, I completely get it. I'm missing out on my son's baseball season, so I'm quite depressed about that. But extending our stay at home for this region is undeniably the right thing to do. And I appreciate County Executive Page and Mayor Krewson's decision, and I appreciate that they are following the science. This decision will help stop the spread, and it will save lives. Before I get to our regular updates for today, we have a guest joining us. So let me introduce Angela Fleming Brown, who is the CEO of the St. Louis Regional Health Commission. And she is working with a number of organizations to drive an initiative called Prepare STL. And this is a collaborative effort to help all St. Louisans for the effects of COVID-19 response. I mentioned this important initiative last week, and I'm really glad Angela is able to join us here and provide an update. Angela, I'm going to turn this over to you.
Thank you, Dr. Garza, for having me today. Good afternoon, everyone. I'm glad to join you to talk about our communications campaign called Prepare STL. As Dr. Garza mentioned, this is a collaborative effort of several organizations, along with community members, to raise awareness of COVID-19, as well as providing information on how to stop the spread of the disease and connect individuals to resources that they may need during this crisis. As part of this strategy, we've developed a very simple flyer that highlights some of the key takeaway messages that we would like to for communities to be aware of. We have also partnered with over 80 community workers who started last weekend, and they'll be out again this weekend, targeting some of the more essential, some of our high area essential businesses like our grocery stores, gas stations, and other places that are open during this time where people are still gathering to purchase goods and other resources they may need. And they are posting flyers, posters, as well as yard signs to really add more emphasis about the messages that we want to get out. We also have a social media strategy as well as a mailing strategy that we are implementing at this time. Our efforts have started in our North City and North County areas, focused mainly on our African American populations that have been disproportionately impacted by COVID-19. We also plan to begin focusing on our immigrant and new American populations, as well as our faith communities and our unhoused individuals who are in desperate need of support during this time. So we are hopefully, by our goal for this initiative is that individuals will be prepared physically, emotionally, and economically, both now and in the future for this pandemic. For more information about the virus and how to get connected to resources, please visit our website at preparestl.com. It is now available in several languages, and you will also find our flyer there in several languages as well. So thank you again, Dr. Garza, for having me. And don't forget, for more information, visit preparestl.com. Thank you.
Great. Thank you, Angela. And thank you so much for your time and from you and all the others that are doing work within the community. Your work is providing information to our at-risk community and saving lives. You'll help St. Louis get through this crisis as quickly as possible. As I mentioned yesterday, we remain on the steep part of the curve. The virus, so we expect around 71,000 cases by the end of April across the region. And so with that, we understand that the threat is continuing to grow, and the work of Prepare STL and others is very critical in preventing the spread. So let me move today now to our numbers. So as you can see, COVID numbers continue to trend. We had hospitalizations today, which is down slightly from 707 yesterday. We're still up to around 50% from where we started this, though, around 11 days ago. We had 179 intensive care patients, which is about the same. We had 175 yesterday. We have 155 patients on ventilators, which is about the same. We were at 149 yesterday. And the good news, we have 41 COVID patients that were discharged yesterday, so that was really exciting. These data are starting to show us that we're making important progress on keeping patients from needing to go to the intensive care unit and from on ventilators. And the more we learn about how this virus behaves in people, the more effective we can be in helping patients with it. I had the honor and the privilege of visiting St. Louis University Hospital and St. Mary's Hospital today. And in speaking with the clinicians there, they are learning therapies that have already been trialed in areas that have peaked before us, and they are absolutely having an impact on keeping patients out of the ICU and off our ventilators. And so I really salute our clinicians and our nurses and our other providers at the hospitals for doing everything they can to help these patients. Now let me reiterate one other thing here, and that is our graph showing the number of infections. So I want to reiterate that the surge is continuing and that we have to do everything that we can to continue to stop the spread. Now I showed you this graph yesterday and we updated it with our new inpatient numbers today. Based on today's COVID inpatient count, we're still up nearly 50% from when I first started reporting numbers to you on April 5th. And we need to keep this chart in mind as we're talking about the weeks ahead. More people are showing up daily to our hospitals with the virus, and this is going to continue. And we have to continue our relentless work to flatten the extent of this curve. As I was speaking with the intensive care physicians at St. Louis University, they had mentioned to me that they had had to admit 6 patients within 2 hours last night. So without a doubt, the curve continues to go up. And it's up to all of us to continue to practice all of those things to keep the curve flat. And that includes our social distancing, stay at home, and all of the other practical things like washing our hands and washing surfaces. And these will continue to drive the numbers down. Public health officials in the St. Louis metro area acted early and put bold and aggressive social distancing and stay-at-home orders in place. These orders continue to be necessary, and they are saving lives. My colleagues and I firmly believe that, and the data show that we have to continue to be diligent in following those stay-at-home orders and social distancing rules. We need to continue those good practices like hand washing, cleaning surfaces, all of those things that can help stop the spread of this virus. We want to avoid second and even third waves of the infection that could be even more devastating than the one we're experiencing right now. I want to repeat that the lack of widespread and fast testing also remains a real challenge, and it has to be addressed before we can talk about reopening an economy or relaxing stay-at-home and other orders. This is part of the effort on how we can start to loosen those restrictions. It's a challenging time for all of us, but I know it is a challenge that we will all get through together. Thank you to the community for continuing to stand together to overcome this virus, and I want to thank everybody for what they have done so far. And with that, we can take a few questions from the media.
We've heard concerns about the antibody tests that are being marketed locally, that these tests are not specifically for COVID-19, but only for coronavirus in general. There have been several subtypes of coronavirus in circulation to which many may already have been exposed, meaning that if one of those tests were to come back with a positive result, it could be for another subtype of coronavirus, giving someone the false sense of security that they may have had COVID-19 and are now immune to it. Do you share the concerns that have been expressed about these tests?
I do. So let me talk a little bit about antibody testing. So the FDA had opened up the ability for companies to start looking at antibody testing through what's called an emergency use authorization. However, many of these tests have not gained FDA approval or gone through the process to validate their findings. And so companies that are advertising that they are FDA approved, it's simply not true. They are not FDA approved. The challenge, as was discussed in the question, is do they have appropriate sensitivity and specificity, and do they test for the COVID-19 virus and not for just plain coronavirus, which is a common virus that causes a common cold in usual circumstances. And so there are a lot of companies out there that are now advertising that they're able to diagnose immunity from COVID-19, and that's simply not true. And so you have to be very careful when you're looking at these antibody tests on if they can deliver what they're actually saying. There are a number of antibody tests which are going through validation studies right now. And we believe in the next couple of weeks we will have sufficient studies performed to assure us and to assure the public that we do have significant accuracy in the testing and that it is testing for the antibody specific for COVID-19. And I want to be also careful to explain to people that just because you have a positive test doesn't really tell you how much antibodies you have or how protected you are. And so it's an oversimplification of the test. The second point is the serology test or the antibody test does not test for acute infection. And so if you are feeling ill, fever, cough, things like that, this is not the test that you have performed. That is the test, the PCR test that we've been talking about quite frequently during our talks.
During the early stages of the pandemic, it seemed that the symptoms to look for were persistent cough, difficulty breathing, and a fever. This outlet has been talking with people with confirmed COVID-19 cases, and those people are talking about other symptoms. Can you talk a bit about other possible symptoms that may be present?
Yeah, so the majority of people that have COVID-19 symptoms, the two most common are a dry cough and fever. That's close to 80% of the patients. After you get past those couple of symptoms, the percentages really drop off. And so it could be anything from, sneezing. Some people have said they've lost a sense of smell, a really wet cough, and even GI complaints. And so when we're deciding on which patients that we should be testing for coronavirus, we try and take all of those symptoms into consideration, as well as what their history is. So have they been around somebody that's been diagnosed with COVID-19? And some of their lab testing, as well as what is their physical appearance. So do they require oxygen? Are they having any problems breathing? But there are a number of other more subtle symptoms, like I mentioned, that could indicate that you have COVID-19.
This outlet has been getting some questions about the 71,000 figure that you mentioned in yesterday's briefing and again today. People are concerned that might mean that the region sees thousands more flood into hospitals. Can you just talk through again and clarify what that 71,000 number includes?
Right, so the 71,000 is an estimate of the number of people that have been infected by COVID throughout the entire St. Louis metropolitan area at the end of April. And so that is a cumulative number. And the majority of people that have COVID-19 will have very minor symptoms. So you've heard me say before, 30% will be completely asymptomatic, or they won't have any symptoms at all. And so those people will most likely never get tested. Those numbers are included in that 71,000. Some people will have very slight symptoms. You know, maybe they run a fever for a day, maybe they just have muscle aches or some other symptoms. Those people may or may not get tested, so those are included in the 71,000 as well. And then, of course, there are that group of patients that are sick enough to seek care and to seek testing, and those people are included. So there is a number of people right now out in our communities that have been infected with the coronavirus and have completely recovered and never even known that they've had coronavirus. And so all of those people are included in that 71,000.
Could you please talk more about how a structured return to a new normal might look in our region, and what the medical community will recommend that government leaders consider?
Yeah, that's a complex question to answer. So let me frame it to you this way. So I spoke a little bit yesterday about what we believe needs to be in place in order for us to make that gradual return to opening up our economy and our community and things like that. And so those are important things like increasing our testing and tracing capability. Doing adequate population-based surveillance studies so that we understand what the immunity is in the population. And so we have to have those sort of building blocks in place before we can start thinking about how we can reopen the economy. Now, when we think about then reopening the economy or reopening in the community, it has to be sort of this stepwise progression. And the way to think about it is, what are some of those businesses that are at low risk for continuing spread? So, of course, our strategy is still to decrease spread, where the probability of spread is rather low. And so think about those things like people that work outside that are socially distant from each other. So that could be anything from like a landscaping crew to construction crews to things like that. And then start thinking about other businesses where there's low probability for spread of the virus. And so you have to put all of that into context. So certainly you would not want to say, well, let's go out and open up the ballpark tomorrow and have baseball games. That would be too many people together, which would spread the virus very quickly, and that's exactly what we wouldn't want to happen. So there's a number of things that we have to think about before we can start saying, these are the businesses that we would open first, second, and third.
And how long could that structured return take? Weeks or months?
That's a great question, and I don't know if anybody has a great answer for it. Part of it is going to be dictated, quite frankly, by the virus, and part of it is going to be dictated by the amount of spread. And so if we take the time that we need to set the strategy in place, so have those building blocks in place so that if we identify a hot spot or acute spread, then we can tackle those things rapidly. And that allows us more time than to do other things. How long it takes to get that structure in place and then to open businesses, again, on that stepwise fashion, it's dictated by virus and spread.
That concludes the questions that have been received by the Task Force Public Information contacts prior to and during today's briefing. If members of the media have additional questions, please email those to the Task Force Public Information contacts, and we will respond to those as quickly as possible. And starting tomorrow morning, we will accept questions for tomorrow afternoon's live stream. Thank you very much for tuning in.